Current at the Associate Family Physician Clinic since 2013. She delivers babies, works half-time in the emergency department, and is also the site director of the new emergency medicine training program starting in Swift Current this summer. Dr. Harrison fills her free time with cooking, eating, traveling, or thinking about traveling after COVID, and spending time with her family. We also have Dr. Peterson. Dr. Peterson is a family physician at the Associate Family Physician Clinic and has been working there since 2017. You may also come across her working in the emergency room or delivering babies. We're told that's the fun part of her job. She also has roles with teaching residents and resident and student doctors, and is the division lead for family medicine in Swift Current. Dr. Peterson enjoys spending time with her 2 young kids, husband, and dog in her free time. And we also have Dr. Flora, who is a first-year family medicine resident in Swift Current. She has come back to her home in Saskatchewan after studying medicine in Ireland. She is loving her training in rural family medicine with a special passion for obstetrics, addiction and recovery, and women's health. In her free time, Dr. Flora can be found baking, spending time outdoors, or traveling, something that she hopes to do once the world is post-COVID. So thank you again for joining us, and we will turn it over to Dr. Peterson.
Hi, everybody. So thanks for joining us. We are our agenda is we've got a few talking points, just kind of about where COVID is at in the southwest of Saskatchewan right now, and where vaccination is at. And then we're hoping that we can answer some questions for you guys, burning topics about COVID and the COVID vaccines mostly. So I think I will let Dr. Harrison start with our intro. We'll see if I can figure out how to go through these slides. Okay, good.
Okay, so yeah, as Dr. Peterson mentioned, we're wanting to talk about COVID, where we've come with COVID and the new COVID vaccines that are currently being offered in Saskatchewan to all of us. So thanks for inviting us to have this discussion. This is a much different COVID discussion than we would have had 12 months ago, and that we did have 12 months ago or even 6 months ago. I think it's important for us to acknowledge that there has been a lot of confusing messages around COVID that have come to us through the media, occasionally from the healthcare system or even the government. I think this has made it hard for people to understand where to find the truth and who we can trust about this. We want everyone to, or I hope everyone can understand that we, like doctors, nurses, scientists, and governments making policies, have had to learn about COVID at the same time as all of you. We had no textbook to tell us how to manage COVID at the start of the pandemic, and some of the things we said, which was often based on what we knew about other viruses, has turned out to be wrong for this specific virus. So our recommendations have changed over the last year as our understanding of this virus has grown as we've gained more experience over the last year. So the big thing to understand, I think, right now is COVID is very much still a problem for us in Swift Current. We have 111 active cases in our region. So that's people who currently actively have symptoms. We've been really lucky in Southwest Saskatchewan to not have many people hospitalized in our region. I think sometimes this looks a little bit better than what it actually is, because oftentimes when we get people that get very sick and need more care, we end up having to send those people to Saskatoon or Regina, where they can provide a higher level of care. So our numbers have looked, maybe a little bit lower than they have really been, but even still, we have been really lucky here. In the context of Saskatchewan as a whole, though, I mean, Saskatchewan has currently the 3rd highest per capita rate of COVID. So that means when you look at, in Canada, so when you look at, the rates in the population, so take 1,000 people, we're the 3rd in the country for rates of COVID, which is pretty significant. Yeah, COVID is, oh, sorry, Christina, I'll let you talk.
No, I was skipping ahead too fast, I think, in the slides here, but that's okay. I can kind of take over. So, like Dr. Harrison was saying, COVID is more of a problem now than it's really ever been in our province. No one wants this to be the case. A couple of months ago, it really seemed like things were going to get better, that, things would improve and our restrictions could lighten up. But now, with more international travel, the variants of concern have posed a new threat. So the variants of concern, as you guys probably know, are a slightly different type of COVID-19. It's still COVID-19, but just different enough to make it spread a little bit more easily and affect people differently. And it seems like more young people are being affected specifically by these newer variants. We've seen deaths in COVID patients under 39 years old in Saskatchewan double recently, and more people have been hospitalized than ever before. So even though our cases are lower now than they may have been, in the fall, we're seeing a bigger proportion of those people have severe illness or end up in hospital, which is really quite worrisome for us in healthcare.
So, the big question is, we're a year into this, and what do we know, and what have we learned, and what do we do to keep ourselves safe and to keep us from, becoming one of those places where this is a big concern. So, unfortunately, the answer isn't anything that we want to hear. There's no quick thing or quick fix that we can do. We need to, continue with following on the limitations and the restrictions that the government has outlined. And these actually, even though we've had very mixed messages and things have fluctuated, there's pretty good evidence that these work when people follow them. So what are our current recommendations? So no indoor gatherings outside of your household. Trying to limit outdoor gatherings to 10 people. And really thinking about who those people are, what their exposures are prior to doing that. Religious gatherings up to 30 people, but spacing 6 feet apart, wearing masks, wearing a mask in public. And this includes at work and even in break rooms, which have been shown to be actually quite a source of spread. Most of the workplace spread is actually through break rooms and from employees to each other. And washing your hands as much as you're able. The other big thing is getting vaccinated. And I'll let maybe Dr. Peterson talk about that.
Yeah, so getting vaccinated is probably one of the best ways that we can get out of this thing that we're all in, right? There's all of the things that we already talked about, all of the public health orders, but vaccines are a really promising light at the end of the tunnel, we hope. So right now, vaccines are available to quite a big group of people in Saskatchewan. So anyone over the age of 44, anyone who's a frontline clinical care worker, such as physician office workers, people who work in labs and imaging clinics. Once the age is lowered to 40 and older, which we hope will be the end of April, all frontline workers over 16 will be prioritized, including police and firefighters. And we're also already seeing actually some of our local emergency services workers like that being vaccinated, which is wonderful. There are also some ongoing studies examining safety in teenagers. And so far, the results tell us that these vaccines are safe and effective in teens. And hopefully someday we'll find out more about kids as well.
And at the end of the day, the vaccines are safe. It's actually been incredible to see globally how fast vaccines have been distributed and how much information we have. This is really something that's, I think, unprecedented in our lifetime, the scale of a vaccination. So worldwide, as of today, 950 million people have received the vaccine, including 250 million Americans. So pretty incredible. And it's difficult to give firm numbers on complication rates. And I did do some looking to try to find out the answer for everybody. But the problem is whenever there is an event or something that happens around the time of a vaccine, it takes a lot of studying, and there's a lot of data to be collected before deciding if that event is from the vaccine or if it's just something that was happening in the background. I mean, there's a certain number of things that always happen in the world. People have health events like heart attacks, all the time, and it's hard to tell if that person was going to have a heart attack anyway that day or if it was because of the COVID vaccine. So it takes some time to pull out that information. But that said, at this point, I mean, we've been giving vaccines since December. So, I mean, 5 months now, almost 1 billion people. And I think what we can say is that any major side effects are very, very rare. Any and every event has been really well reported and well documented, kind of for better or worse. Sometimes they're over reported. And at the end of the day, these honestly look very safe.
All right. So, and before we kind of move on to our Q&A, we just wanted to say that we're tired of this too. And we know that everyone else is, right? We're sensing a lot of frustration from our patients, from the people we work with. People are ready for this to be over. Government workers, healthcare workers, we all miss our friends and our families too. We miss seeing our patients and friends' smiles. We miss seeing our kids in activities, and we understand the frustration and the mistrust that everyone must be feeling. We want to stress that we think we are close to the end. We hope we are close to the end here. The way through this third wave is to continue to follow the recommendations on gathering and keep cases low while we continue to expand vaccination programs, and we can all do our part by getting vaccinated. And I think that probably brings us to some questions about vaccines. So we did have a list of questions here. Do you want us to, or do you want to ask questions, or I don't know if you're going to run through the list or just open it?
Do you want us to start with asking the questions on the list, and then if somebody wants to pop up with a question, we can, Aaliyah and I can just kind of maneuver in and out of kind of the pre-questions we have and any that come up. Does that sound okay?
That sounds really good.
All right. I have one of the first questions I have is, when will kids be able to get the vaccine?
I can take that one. The truth about that is that we don't totally know yet. The COVID vaccine we've started testing the COVID vaccine in children. So specifically, Pfizer has started a trial with kids as young as 6 months. So we are expecting that in the next few months, we'll learn more about the safety and how well vaccines work in young children. And we expect that they're going to be really safe and work well, just like they do in adults. But of course, we like to know that for sure before we start vaccinating our kids. There already is good data from the Pfizer vaccine, I believe for age 12 to 16, that there is some safety and efficacy data, which is great. And hopefully we'll learn more in the next few months. But I don't have a firm date on when we will start vaccinating kids.
Okay, thank you. So the next question we had was, are all the vaccines safe?
Yes, so all of the vaccines approved in Canada are very safe. I think they all have been shown to be very effective at preventing hospitalization and death, and they all are very safe. All major adverse events are very, very rare, and much more rare than a lot of things that we use commonly without even thinking about. And then I should say also, there's a National Advisory Committee on Immunization Canada. They keep track and record all any reported adverse events, and they've been deemed safe by that organization.
Thank you.
Thank you. I have a tough one here. When will things get back to normal?
This is another one of those we don't know yet answers. and a lot of that depends on us, right? It depends on whether we follow the public health orders and avoid spreading COVID, and it depends on whether or not we choose to get vaccinated. The sooner our population is vaccinated and the spread of COVID-19 slows down, the sooner we can get back to our normal.
Were you done? Okay, just making sure. Okay, so another question we have is, which vaccine is the best?
Yeah, and you've probably seen this answer everywhere, but the best vaccine is the one that you can get. But really, I mean, we've seen a lot of people saying, I want this one, I don't want that one. At the end of the day, all of the vaccines are effective. All three vaccines being offered in Saskatchewan are, like I mentioned, extremely effective at preventing hospitalization and death, which is the most important thing. Different ones have different statistics on effectiveness around, infection rates, but really the thing that matters the most from a bigger side of things, or what we really care about, is it prevents severe illness in it. So. And then there's just a question just about this thing, they prevent hospitalization and death. Does it prevent contracting COVID? And yes, they do. Nothing in medicine is 100%. They're all very effective, but some are, 90% effective, some are 80% effective. And I think people are getting really caught up in those numbers. But at the end of the day, the thing that's important is they prevent you from getting very ill. So they're all very effective at preventing you from catching COVID or transmitting COVID. Nothing is 100%, but they're all effective at preventing you from getting very sick.
So I just saw another question here in the chat. Is a 4-month period between vaccines safe? And they're also asking about statistics.
Ooh, yes. So this has also been a really hot topic issue, obviously. The statistics are a little bit more tricky, and I'm sorry I don't have specific numbers for you. But I have kind of some gross numbers from what we've seen in real world so far. So the intervals that were chosen for the vaccines were partially chosen because they wanted to get these trials done as quickly as possible, though safe, to be able to get people vaccinated quickly. So, waiting 4 months to do a second dose in a trial was really not a viable option. But now that we're out in practice and can see the amount of immunity or protection that people get from one dose, we've realized that maybe the doses don't need to be 3 weeks apart or 4 weeks apart. Maybe they can be further apart. So the answer is yes, it is safe. And this is a recommendation that's come from NACI, our National Advisory Committee on Immunization in Canada, who survey all the evidence and give us recommendations on how to best vaccinate our population. So for our vaccines, our mRNA vaccines, so Pfizer and Moderna, we know that after a single dose, you have almost as much coverage as after 2 doses. So we think that within a few weeks after a dose of the Pfizer vaccine, you probably have about 80 to 85% protection against getting COVID-19. And it's kind of similar numbers for Moderna. We're not totally sure, the Astrazeneca hasn't been out as long. We're still gaining information, but we think that it's very close to what the 2-dose efficacy is as well. And I'm using big words, but for these vaccines. So yes, I think it's safe. And the bonus is that we can vaccinate twice as many people in that amount of time if we're only giving 1 dose. So I don't know, I would rather only get 1 dose and have, my neighbor be vaccinated than get a few extra percent coverage and someone else not be vaccinated.
Thank you, Dr. Peterson. I see a question in the chat that says, not sure today, but Swift Current did not seem to come out as an option as a location. Why is this so? I'm going to assume that this is in regards to booking vaccination appointments. And so what I just want to say from SHA is that as soon as we have guaranteed doses of the vaccine, appointments are put up. And so we just want people to know, keep trying, and those appointments can disappear like that. So sometimes when you're on the phone, when you phone the 1-800 number, as you're talking, the appointments will disappear. So we just encourage people to keep trying, and what we want people to know that we are using every single drop of the vaccine that is available. So we're very precise about the numbers and the appointments that we give out, because we want to make sure that there is zero waste. And that we're getting as many people in as possible. But we do need to kind of make sure that we have the guaranteed doses before we put appointments up, because as people are aware, there's been a lot of change in what becomes available and what's sent to us. And so people have had to have their appointments canceled. And I know that's been a frustrating experience for some folks. So we are trying our best to just, make sure that we're putting appointments up as the vaccine becomes available.
So I have another question that we were going to ask, but in the chat it was more expanded on. The question is, there are less or not many clinical trial runs right now comparing with other vaccines. We talked about the short-term effects, but do they know, is there more long-term effects?
So, at this point we have 5 months of information about these vaccines, and there haven't been shown to be any, really long-term effects. This is the same way that we gather information for every medication and vaccine that's released. Trials only go a few months. In laboratories with volunteers. And then after that, all medications are released into the world, and then they gather this 4th phase of trial data, which is the real world data. And it's only when you, once that is being used in that scale, because you just can't test millions of people or millions of doses in a trial, in a laboratory setting. So that information is being gathered the same way that it's being gathered with every medication that's released. So in terms of long-term effectiveness, or long-term side effects, there's no reason to think that there will be. I mean, we don't really have that with other vaccines, but we won't know that until we have years of data. Which is no different than any other medication or vaccine.
Thank you, Dr. Harrison. Another question from the chat is, what percentage of the population would need to be vaccinated to have things go to normal? For example, no longer needing to wear masks.
And can I just tie into that quickly with the next point we have, because they kind of go hand in hand, I think. So someone sent in, many think that everyone has had the COVID-19 infection once already, and those who had it just didn't show symptoms and now they're immune to it, so like herd immunity. And they think that once you've achieved herd immunity, you do not need the vaccine. And it kind of ties into this, when can things go back to normal percentage of vaccines?
Totally. So I agree. I think that question is all about herd immunity. Like, what is herd immunity for COVID-19? And I don't know that we have a specific number. It's probably changing all the time, depending on how transmissible the virus is. And with the variants, probably somewhere in that like 80 to 85% range of the population needs to be immune before we would consider that we have herd immunity. And kind of pulling into that that second part of the question. So I think that's a pretty common misconception. A lot of people think that that maybe they've already had the COVID-19 virus, they were ill at some point last year, so they don't need to be vaccinated, they don't need to worry about getting sick. But it's actually not true. We think that the immunity from natural infection, so if you get COVID, only lasts a few months, maybe 3 to 6 months. And there have certainly been many reported cases of repeat infections. So people can get COVID and then 6 months later get COVID again. The vaccines, we think, will provide a much longer length of protection against COVID. So even if you think you had it before, it's still very important to get vaccinated. We do, though, recommend that if you get COVID, you wait 90 days before you choose to get a vaccine, because you have that natural immunity for those 90 days and someone else can get vaccinated in that time. But after that, get your jab.
Thank you, Dr. Peterson. Another question is, are the variants covered in the vaccines?
That's a hard question to answer, because there's new variants emerging all over the world, and they probably will continue to emerge so long as, you know, there's large populations in the world that are not immunized. So places like Brazil and India, where there's, you know, lots of people being infected and lots of opportunity for the virus to change. So there's we don't probably even understand all of the variants that are there. That said, the common variants in Canada, the number one, I think upwards of 90% of the variant infections that we're aware of in Canada are the UK variant, and it is effective for that. So the variants are the shifting sand, the hardest part of the conversation around COVID, because I don't think even the best disease specialists in the world totally understand where we're at with global variants. But the common variants now are effective, are susceptible or prevented by the vaccine.
Okay, thank you. So the next question I have in the chat here is, can you transmit the virus after the first shot? Maybe we can touch on when you have 2 shots and you're completely vaccinated.
Yeah, so anything is possible. The first dose of the vaccine with any of our available vaccines is very effective at preventing COVID-19, but nothing is 100%. So there is always a small risk that you could transmit the virus if you were to get sick. Probably less so. We think people who are vaccinated will have more mild illness, which means they might have less virus in their system and pass it on less. But certainly, even if you've been vaccinated, if you get sick, you should still isolate and get tested to prevent spreading it to anyone else. And then, of course, after the second shot, same deal, right? Your protection's a little bit better, but you still need to isolate if you get sick. You still need to get tested if you get sick. And we're not going to be out of mask wearing just yet.
All right, so I have the next one up here, Courtney. Do you mind if I go again? So pregnant women have been given the green light to receive the vaccine and are now priority. Given that pregnant women are also recommended to receive the Tdap vaccine, and there is a waiting period between the COVID vaccine and other vaccines, what is the priority, specifically for women in their 3rd trimester who may not have the luxury of time before delivery?
COVID. The COVID vaccine. No. So just to explain, we do recommend, so here in Saskatchewan, you know, we do, or the recommendation in Canada is that anywhere where there's a endemic whooping cough infections, women should have a booster heading into their 3rd trimester for their Tdap. So it's specifically for that pertussis or whooping cough. We haven't seen a lot of whooping cough lately. We have had outbreaks in our region and nearby our region that have been quite significant. Those are most commonly in the winter. Newborn babies before they're vaccinated are very vulnerable to whooping cough, so it is important. I would say in our current context right now, whooping cough is a concern for like next winter, and COVID is a concern like right now. So I would definitely prioritize COVID. I don't know.
Okay.
Dr. Peterson, I don't know if you agree with that sentiment. We hadn't discussed that. But.
I agree completely. And this is a question that's been coming up a lot in my clinic lately, actually. And there is some recommended timing between the doses. And I don't want to get it wrong, but I think they tell you to wait 4 weeks after getting another vaccine, and then 2 weeks after the COVID vaccine to get another vaccine. I might have that backwards. So don't quote me on it, but certainly I've been recommending that if my patients are wanting to get the COVID vaccine, that we prioritize that over that 36 weeks to give that Boostrix or Tdap vaccine. So usually we can fit in both.
Okay, another private pregnancy question here. So they're saying chickenpox virus has adverse effects on fetus. They're just wondering if there's any effects on the babies of COVID positive moms.
So that's a really good question, and we actually probably won't fully understand the answer for that for quite some time, because how they determine that is they actually have to follow babies that were exposed for years and do developmental testing on them. What we can speak to and what we have seen is that pregnant women are more prone to severe COVID, as they are with most respiratory conditions, and that the immediate pregnancy outcomes in terms of, say, like loss of the baby or problems with the baby's growth directly follow the severity of the mom's illness. So moms in the ICU, you know, are much more likely to lose their baby or have to have, you know, their pregnancy induced early because of growth, the baby not growing properly. Moms with mild disease, you know, apparently seem to complete their pregnancy okay. We don't have information beyond a year because this hasn't existed for beyond a year. So the oldest babies that have been exposed to COVID are a year, and that's as far as we can say.
Thank you. So I have a couple questions here that I'm going to tie together. Do you need to isolate after the first shot? And after you get your second shot, can you stop wearing a mask?
Yeah, so I think we did kind of already cover this, but absolutely. So if you get sick after your first shot, you still need to isolate. So you don't have to isolate after your vaccine, but if you become unwell after getting your vaccine, you do have to isolate, and we recommend you get tested for COVID-19 if you have any symptoms. And then same thing after your second shot. If you get unwell, it's best to isolate and get tested. And then we're not at the point of getting to stop wearing our masks yet. I know we're all looking forward to that, but that's going to be a little bit in the future, I think.
All right, so another question we have is, can people with health conditions, cancer, heart disease, diabetes, Crohn's, have the vaccine?
Yes, they are recommended to get it. We know people with existing medical conditions are far more vulnerable to serious illness with COVID, and there are very few and very rare diseases that are contraindicated to the COVID vaccine. So I know initially, you know, when it first came out, I don't know about Dr. Peterson, but I was, you know, leery and worried and telling everybody to talk to their specialist, and the answer uniformly has been to get it. So.
All right, Courtney, our next question I think has been covered. Why do we need to get vaccinated? So we can move on to the next one. So the next one is asking more towards our newcomer community and visiting community. So someone asked, can my mother receive the vaccine even though she is just a visitor to Canada, and how much would it be?
Yeah, so I actually had to do some asking around to find out the answer of this question, and the answer is yes, she can. So she'll just need to present her passport as ID to get her vaccine and also sign a waiver. And as a visitor, it is important to know as well if you'll be able to get your second dose of vaccine if you're planning to return home during that interval before you will be eligible for a second dose. And hopefully you'll be able to then get a vaccine that will also be available in your home country. There are sometimes some differences in brand names of vaccine between different locations, but certainly your mother can be vaccinated, and it is free, no charge.
And is it still free if they don't have like an Alberta, Saskatchewan BC healthcare card?
I believe so. I don't know if Courtney has more information on that, but I believe it's free for anyone as long as they can show ID.
Yes, I believe so. And
Sure.
there is some criteria, but I'm not 100% sure. I believe you have to be in Saskatchewan because we have had a few folks with a Alberta health card that have come through the vaccine clinic. And I believe there's a criteria that they have to have been in Saskatchewan for, I can't remember honestly off the top of my head if it's a certain amount of weeks or month. But yes, our goal is just to get as many people vaccinated as possible. We also had a question I'm just going to cover as well. One of the questions that we had was, I'm 55 and had my first vaccine dose. When can I expect my second? And we are getting that here at the vaccine clinic on a regular basis. We're getting people asking that question. And we just want people to know that as vaccines become available and a majority of the population have had their first dose, we will ensure that there is a lot of public announcements. Please listen to the radio, listen to the news, to the TV, social media. It will be very widely, the information will be out there when people can start booking appointments for their second dose. We're not exactly sure on a exact date at this time or how that's going to look, but please know that we are going to keep people informed as we become aware.
Thanks for answering that, Courtney. So the next question I have is, are the vaccines safe for moms who are nursing and their babies?
Yes. So, likely, so with nursing, all moms pass on their immunity. So if you're exposed to a cold, you pass on, it's actually really cool, you pass on some of your immune system workings onto your baby. And the same goes for the COVID vaccine. So you're not passing on pieces of the vaccine to the baby, you're passing on your body's immune reaction, which is healthy for the babies. And that's the big advantage of nursing. So it's all game with lactating moms or nursing moms getting the vaccine. You kind of get to immunize 2 for 1 almost.
Perfect. Okay.
We have another question in the chat. When would it not be good to get a vaccine? Example, a sickness, etc.
Yeah, so there's actually very few contraindications, which means people who absolutely should not get a vaccine. I certainly encourage everyone to talk to their family doctor if they have specific illnesses that they're worried about. I think this question may refer a little bit more to what if I have a fever and a cough? Should I get vaccinated? Probably not. You should probably wait until you're feeling well. And a big part of that is just that we don't want people who are actively unwell coming to the vaccine clinic and risking spreading that to other people who are coming to get immunized. So if you're unwell with fever, cough, shortness of breath, rebook your vaccine for a later date. But otherwise, if you have concerns about chronic illnesses, talk to your family doctor. Chances are they're going to tell you to go ahead and get it.
Okay. So there's another question that someone had asked me about. There's been rumors regarding fertility that many young people in the 20s to 30s age range are worried about receiving the vaccine because of this. Can you touch on that?
Dr. Peterson might be able to speak a little bit better to this than me. I know initially this was a little bit of a concern. I think it's been proven to be a bit unfounded. I don't think that there have been any issues, and even our fertility specialists in the province are encouraging their patients to have the vaccine prior to conceiving, with the idea that it's not going to affect their fertility. So
yeah, that's exactly right. I think this has been totally debunked. So there was an idea that one of the proteins that allows the placenta to attach to the uterus looks similar to the spike protein in the vaccine. So then people thought, oh, if I get a vaccination against that spike protein, it will also attack that protein that will allow a placenta to attach to my uterus, and I won't be able to keep a pregnancy. People were worried about miscarriages. But that's been completely debunked. The proteins, although they may appear slightly similar, they have different makeups, They don't cross-react, which means that there's really no concern about fertility after getting this vaccine.
Okay, thank you. I have another question in the private chat here. So they're saying antibiotics don't have results if not taken within proper time window. Is that the same if the second dose is delayed due to shortage or due to allergic reaction?
So no. So in fact, there's been really good information that the second doses are maybe even a little more effective when they're delayed longer. I mean, I think that's pretty tentative and we don't know that for sure. Antibiotics are a little bit different because antibiotics don't use your body. You're just giving something that's kind of like a fire extinguisher where it just sort of puts out that flame and kills those bacteria. And if you don't kill them in good enough time, then they get out of hand, just like a fire kind of. Whereas the vaccine, you get the vaccine and then your body just like works and works and works and works. And we think, you know, having longer to work to build that immune response before it gets boosted again probably isn't a bad thing, actually.
Sorry, to tie into that question, are we to expect that we're going to need to get this COVID vaccine annually?
Oof, that's a good question.
I don't think we know that yet. There's certainly been lots of talk about that, and people are wondering if that will be the case. And I think that kind of depends, like how quickly we get this under control and how much the variants kind of continue to change and mutate. If the variants continue to spread and change and get to the point where our vaccines don't work as good as they do now, then we may need, you know, kind of a booster every year as the COVID-19 virus changes. But I think our hope is that that will not be the case, that we will get this under control and get lots of people vaccinated now, and we won't get to that point. But I think it's a possibility.
So AstraZeneca has received a bad rap in the media in regards to causing blood clots. Can you speak a little bit more specifically to that and just what the risk is for folks with the AstraZeneca vaccine?
Yeah, so I think this is, you know, probably one of the more disappointing things that has come out of our media coverage of COVID. The risks specifically around blood clots with AstraZeneca are very small. It's a very specific, I think the important thing to kind of remember or to bear in mind is that these are different blood clots than, say, a blood clot that would, you know, cause a blood clot in your leg or a blood clot in your lung. And it's actually totally unrelated to the vast majority of conditions that cause blood clots. The reason that this has stood out is because the type of blood clot and the way that it forms is so unusual, and that's what flagged it to be studied. So it's not that it's been common. In fact, it's been exceptionally rare, somewhere around 1 in 100 to 1 in 200,000 incidents, which is in medical world, that's not something, like, for us, that's a very rare occurrence. And I can understand it's a very scary complication, and I get that. But it is certainly not a reason to not have the COVID vaccine. And, you know, like I mentioned, it's completely unrelated to other causes of blood clot. So even if you've had a blood clot, you're still okay to have the AstraZeneca vaccine. And yeah, this is like,
sorry, I'm not very technologically talented, but I was quickly trying to get up this nice infographic that kind of speaks to that as well, the risk of blood clots with the AstraZeneca vaccine. Can you guys see this?
Mm-hmm.
Yeah, and it compares it to like other things that can cause blood clots, including COVID-19 infection, which is actually a lot more likely to cause a blood clot than the vaccine itself.
Yeah. So it really is, I mean, if I was offered the AstraZeneca vaccine, I would accept it because I really do believe it's safe. My family members have received it. It really is, it's safe, and the risk of blood clots is vanishingly small.
I like to share a bit of a personal story with my patients about this too. My parents were booked to have COVID vaccines in a few weeks. They had booked appointments, and then that AstraZeneca walk-in clinic came up on Good Friday, and I told them to cancel their appointments and to go to the AstraZeneca walk-in because it meant that they were going to get vaccinated 2 weeks sooner. And I really feel like it is safe, and we know that it is 100% effective at preventing hospitalization and death. And that's really what I care about, right? I want my parents to not end up in hospital and die. And I think that's what we all want for our family members and our friends and our patients. So I think that's a really powerful thing, and this vaccine works really good.
I'll actually second you there, Dr. Peterson. My stepmom, the day that the age was lowered for her, she drove 2.5 hours to get her AstraZeneca vaccine. And she was so excited. And that was like the first thing I said to her. I was like, oh, congratulations, this is amazing. And it's definitely safe. And we were all very excited for her when she got it. So.
I actually have just a clarification, if that's okay. Because we have heard, and which is great, that the vaccines would prevent hospitalization and death. But we also heard earlier that you can still get sick. So just, to put it in more layman's terms, the vaccines will not prevent you from getting sick, right? It will prevent you from being really sick and from dying from this virus. Is that correct?
They'll make you much less likely to get sick, but it's possible to become infected with COVID, but it's almost impossible to get very sick with COVID if you're immunized. Would you agree with that, Dr. Peterson?
Absolutely. And I mean, we're still learning, and I think that the numbers will show themselves more and more with time, as more millions and millions of people get vaccinated. But that's exactly it. You're very unlikely to get sick at all after you're vaccinated, and then especially unlikely to get really sick.
I think we have another question in the chat. Okay, let me just read this. Has there been new information to support the recommendation that pregnant women should get the vaccine? Earlier information had indicated that there was not enough data to support pregnant women getting the vaccine. And then another question is, will it be easier to travel to another country if I got the vaccine?
Yeah, so for that first question, pregnancy is always difficult because we usually do not specifically test medications, vaccines in pregnancy, because it's a really vulnerable time. So there haven't been any trials specifically dedicated to pregnant women, which means that the vaccines have not been formally kind of approved in pregnant women. But having said that, we really think they're safe. There's not a lot of reason to think that they wouldn't be. And lots of women have either been accidentally vaccinated in pregnancy, such as in the original Pfizer trial. About 30 women kind of found out they were pregnant after the fact and went on to have healthy, normal pregnancies. And since then, tens of thousands of women, or maybe more by now, in the US and across the world have been vaccinated in pregnancy with no known adverse effects. There's no reason to think that this would harm a pregnancy or babies, but we do know that severe COVID-19 infection does harm pregnancies and babies. So it's kind of one of those, like, we know there's risk with COVID, we don't think there's risk with the vaccine. So it's definitely a risk-benefit balance for each person and each pregnancy. But I'm certainly becoming a lot more comfortable recommending this vaccine to my patients as time goes on. I think that they're safe. And we're certainly seeing more severe disease in pregnant women with these variants, especially, you know, in Eastern Canada and Toronto. They're seeing lots of hospitalized women in the ICUs who are pregnant. So I know it's a really difficult decision for pregnant women to make, but I would encourage them to talk to their doctors about their specific risks. And I really believe that it's safe in pregnancy. Dr. Harrison, do you have anything to add to that?
No, I think the hard part with this is the language that we use, because we never have trial data, like Dr. Peterson said. Like, and so we always say that data is limited regarding safety in pregnancy, and you would find that if you looked at Tylenol or many medicines, like anything. But we really have no reason to think it's not safe. And we now have all of this data, tens of thousands of pregnant women that have had it. So.
Okay, thank you. I have some more private questions in the chat. There's a word in here like that I don't know how to pronounce, so bear with me. Maybe the doctors here will get it. If you have thrombocytosis, do you guys know what I'm talking about?
That was good.
We do.
Okay. Is Astrazeneca still safe?
Yes.
Okay.
Yeah. The only condition that can't receive Astrazeneca is a very rare condition called heparin-induced thrombocytopenia. That is the only condition that, and it's just an exceptionally rare disease that almost never happens in people that aren't hospitalized.
Okay, and then I have another private comment. I received the letter as an extremely vulnerable individual back in March. I was only able to book by phone. The appointment was booked 3 weeks away, then postponed. By the time I can go, my age group, around 40 less, will be eligible province-wide. If it is taking 6 weeks to get the vaccine, what was the point of the letter? Seems unfortunate if I'm considered extremely vulnerable.
That's really frustrating. I don't have a good answer for that. Unfortunately, vaccine supplies have been limited and we haven't always received the vaccine allotments that we were expecting, and we've had to delay some people's vaccines, and I think everybody is really sorry for that. Another option, I think that, and correct me if I'm wrong, Courtney might know better, but I think people who are considered clinically extremely vulnerable and pregnant women can also attend drive-through or walk-in vaccination clinics that are for that younger age group, so the ones with the mRNA vaccines. But I think as long as depending on what your age is, as long as your age fits into the category that they're vaccinating, then you can still attend those walk-in clinics. The only exception was when AstraZeneca was doing only 55 plus. You know, if you were 40, you couldn't go to a walk-in AstraZeneca clinic with your CEV letter. But otherwise, I think you're allowed to go to the walk-ins. I know there's not one happening in Swift Current right away.
And I think the other thing too is as the ages are lowered, the people that are clinically vulnerable or frontline workers will be prioritized within that age group. So it's not like you're just then lumped in with everybody that's your age. You would still be sort of at the front of the list, although I agree that it's been a frustrating process, I think, for everybody involved in some ways.
And we encourage people, I know that as people have attended the drive-through and walk-in clinics that already had appointments booked, absolutely, do so. And if possible, I know there's been some glitches in our online booking system with canceling appointments, but, as I said before, we use every single dose that's available to us each day at the clinic. So, if people can cancel their appointments in advance, if they end up attending a drive-through or a walk-in clinic, that really helps us to fit other people in that we've had to cancel and move around in the schedule. So, we really just want to assure the public that we are absolutely utilizing whatever we receive in the best way possible.
Do we have more questions?
I don't have any more private questions. Courtney, do you have any more private ones?
I do not have any more private questions. I just wanted to let people know if I can, if questions pop up, in the meantime, please, we'll make sure we answer them. But I just wanted to let people know that they can go to the Government of Saskatchewan COVID website, or they can call 1-833-727-5829 between 8 a.m. and 11 p.m. 7 days a week to book their vaccine appointment. And so what you'll need for that is your first and last name, your date of birth, your health card number, and either a phone or email contact so that a reminder can be sent. So it's a fairly simple process, although I know frustrating when we don't have a lot of appointments in our area. And we've heard people that said, the closest one is, Martinsville or Dinsmore. So, please bear with us and know that we will get appointments uploaded as soon as we have vaccine allotments available. And we want to let you know that if you're a newcomer and you're feeling like you need to bring somebody to help with interpretation when you come to your appointment, we do welcome that. Yourself and your interpreter would need to be screened at the door as we screen everybody. But we really do encourage, bring someone in with you that can help with the process, just help it to be smooth and comfortable and ensure that you're getting the information that you need. And I think Aaliyah, actually, I took a few pictures today of the vaccine clinic just to give people an idea of what it's like here. And I believe Aaliyah whipped together a slideshow for us. So maybe if we can maybe show people that. And then if they do have any questions, you can let us know.
Mm-hmm. So while Aaliyah is preparing the PowerPoint presentation, there is just one question that came up while Courtney, you were explaining. Is there enough supply for everyone?
So I think the supply is constantly being produced by factories. There will be enough for everybody to be vaccinated. Everybody that wants to be vaccinated will be vaccinated eventually, not necessarily next week. And I know we all wish it could be faster, but eventually there will be enough supply for everyone.
Okay, can everyone see my screen right now? Just the PowerPoint? Perfect. All right, I'll go to the next one. Courtney, I just put a few on one slide so people can take it in as you explain it. Okay.
Absolutely.
Oh, okay. How does that look?
All right, so we are at the Old North Side Medical Clinic, which is across the highway from PV Mart and Dollarama. So just the corner building there, and we have some signage. So we also do the swabbing here for testing at different times during the day, but we do keep the vaccine folks and the people that are coming in for swabbing separate. So there will be signage that will direct you, and there is a lot of staff around that will make sure that you know kind of where you're going and what the process is. So what we have here is one of our staff, and she's in full gear, full PPE, and we do a thorough screening at the door, questions that people are probably very familiar with at this point. We get you to sanitize your hands. We are asking everybody to switch out their masks to a fresh mask. With the variants that are in the community, we want to be extra careful. So we have a lot of people say, I just put on a fresh mask. We're just getting everybody to change at the door. So we're getting a fresh mask, and then we're going to get your temperature taken. And then once you do that, we can flip to the next slide. You'll go to the registration desk, and there will be somebody working there that will take your health card number. And what they will do is they will verify that your information, so they'll verify your date of birth, that your health card number is correct, that your phone number, email address is correct. So just kind of a verification. We want to make sure that we've got all the correct information in the system, especially when people have booked via the telephone. Sometimes, when we're reading out numbers, things can get punched in wrong. So we'll get you through the registration process. These things happen very quickly. So, usually within, 30 seconds, you get your screening, 30 seconds to a minute, go through the registration process, another 30 seconds. The empty area, I didn't, of course, want to take pictures of anybody waiting for vaccines. So one side of the room is for people waiting for vaccines. We usually have six nurses or physicians working at a time giving vaccines. So it actually happens really quickly. It's a great, smooth process. We'll direct you into a private room to get your vaccine. The nurse will spend the time explaining the vaccine. If you have any questions about medications you're on, about side effects, anything like that, the nurse is there to ask. And then after you come out, we put you on the other side of the room. You get a little sticker that goes on your clothing or someplace where we can see. And there's a nurse is available to, just look after people for the 15 minutes after their appointment to ensure that there's no adverse reactions. Make sure everything's okay. Usually adverse reactions, the doctors can correct me if I'm mistaken, but happen quite quickly with vaccines, the allergic type reactions. So we keep you there for about 15 minutes in our waiting area, and then we send you out. And I have a picture of one of our nurses, so that would be an example of the clinic room. So one of our nurses that's in there providing the vaccine. So it's a really good experience for sure. Very smooth process and a really good experience.
Courtney, there's a comment in the chat. Everyone is very welcoming at the clinic, especially Courtney.
Aww.
Thank you.
Well, I can tell you, the environment here at the clinic is just fantastic. It is so nice to the energy that people have, knowing that they're getting their vaccine after this long year and some of waiting and just being in this unknown. I think people are really excited for that. So it's been extremely positive, and I've really enjoyed being here. So absolutely.
Well, we have come to the end of our session. Unless someone, has a question before we go, I think we can call it a good night. We really learned a lot from our doctors tonight, and Courtney as well. I've learned that I need to get the jab. And so I will be trying my best to go online again and get my appointment as soon as I can. And any vaccine that I can get is the good vaccine, is the best vaccine for me. So once again, thank you for being with us. Thank you for coming with us. Thank you for all your questions. Thank you, Dr. Peterson, Dr. Harrison, Dr. Miranda. Thank you, Courtney. Thank you, Aaliyah. Thank you, everyone. And we hope that you have also learned from this information session. And spread the word, get the jab.
Perfect. Thank you for having us.
Thanks,
everyone.